Okay, let's talk about case 24. And who shall we be today? This one? Nope. I think I will be an alien. An 18-year-old presents to clinic with a fever and headache. She also complains of vaginal itching and dysuria. When asked, she says that she recently became sexually active. Physical examination reveals tender inguinal lymphadenopathy and red, pustular, painful vesicles on her labia majora. What is the most likely diagnosis? One moment here, I need to calibrate. Okay, we are calibrating. Okay, we have calibrated. So continuing on here. So what is the most likely diagnosis here? Herpes simplex virus type 2 or HSV. The pathognomic findings for herpes infections are painful vesicles. Both HSV1 and HSV2 can cause genital herpes, but more than 80% of genital lesions are due to HSV2. What are the characteristics of this pathogen? HSV2 is a member of the herpes viridae family, which are double-stranded DNA viruses and include HSV1, varicella virus, varicella zoster virus, or VSV, Epstein-Barr virus, cytomegalovirus, human herpes virus 6, and human herpes virus 8. They can be recognized by multinucleated giant cells on a zinc smear and by eosinophilic intranuclear inclusions. What is the differential diagnosis of painful genital lesions? Cancroid caused by Haemophilus ducreyi infection, lymphogranuloma, venereum. Caused by chlamydia trachomitis and granuloma inguinale, caused by Klebsiella granulomatis. Also cause painful genital lesions. What is the typical course of this infection? HSV2 is transmitted by direct contact of the virus with mucosal surfaces or open skin surfaces. It can also be transmitted from mother to newborn during delivery. Approximately 80% of infected patients are asymptomatic. The primary infection often presents with constitutional symptoms such as fever, headache, malaise, and myalgia. Later, genital vesicles may appear that can rupture and leave behind painful ulcers. Other genital symptoms include itching and tender inguinal lymphadenopathy. Like other viruses in the family, HSV2 becomes latent and can be reactivated. Triggers for reactivation include fever, trauma, emotional stress, sunlight, and menstruation. Upon reactivation, there is often a viral prodrome that involves tenderness, pain, and burning at the future site of vesicle eruption. The lesions last 4 to 15 days before crusting over and reepithelializing. Try to say that backwards. Where do herpes virus species remain latent? In the peripheral nervous system ganglia. HSV1 tends to remain latent in the trigeminal ganglion, reactivating and causing oral herpes or cold sores. HSV2 and VSV tend to remain latent in the dorsal root ganglia of the sensory afferents. This gives rise to the pathognomic dermatomal distribution of reactivated zoster infections. What is the treatment for this condition? The treatment for HSV2 is acyclovir, a nucleoside analog that acts by inhibiting viral DNA polymerase when it is phosphorylated by viral thymidine kinase. However, because efficacy requires viral thymidine kinase activity, any herpes virus lacking a functional thymidine kinase will be resistant.